Welcome to respiratory motions using the ExSpiron in volume sync mode. Remember, the ExSpiron has 3 modes of patient monitoring to choose from. Basic monitoring is generally used for adult patients and is the most widely used mode of patient monitoring to date. Basic monitoring is not available for pediatric patients below 35 kilograms in weight. Volume sync is used for adult and pediatric patients that start out on a ventilator in the ICU or operating room and will be monitored with the ExSpiron after they have been extubated. It is especially useful for those that have or may develop bilateral asymmetry. Percent baseline is used for pediatric cases below 35 kilograms who did not start their monitoring while on a ventilator and for other specialized situations. At this point, you should have watched the general overview and basic monitoring videos. If you have not done so yet, please review them before proceeding. As discussed in earlier videos, placement of the disposable pad set is key to the proper function of the ExSpiron Minute Ventilation Monitoring System. The application of the pad set is meant for clean, dry, intact skin. Routine skin prep using alcohol or other skin prep solutions is recommended prior to placing the pad set on the patient. It is also recommended that if a patient would require shaving or clipping for EKG electrodes, you follow your facility policy and perform this accordingly. For easy placement, there are 3 anatomic landmarks: A, the sternal notch, B, the xiphoid, and C, the mid-axillary line at the level of the xiphoid. The pad set is designed to help placement on the right side of the patient's chest at a 90-degree angle. Start by locating the patient's sternal notch. Place pad set labeled head 1 centimeter below the top of the bone at the sternal notch. Next, move south in a straight line, letting the desired length of the pad set strip pull out of the pouch to meet the patient's xiphoid process. The smaller round pad should be placed here. Lastly, moving 90 degrees from the level of the xiphoid, again pulling the desired length out from the pouch, allowing you to reach the patient's right mid-axillary line. The center of the pad set labeled side should be placed here. If too much of one of the pad set arms has been pulled out, you can push it back into the pouch so it is flush with the skin. After the pad set has been placed on the patient, connect the tail of the pad set with the black connector to the white patient cable coming from the ExSpiron. You can affix the clip, which is located on the white patient cable, to the patient gown to assist in preventing any added tension of the cable and/or the pad set. Setting up the ExSpiron Minute Ventilation Monitoring System is quite simple. The power button is located on the left-hand side of the monitor. All you need is one single yet firm push of the black button. The ExSpiron will turn on. This may take up to 30 seconds. You know you are ready to start initiating the setup process when you see this home screen. To get started, simply touch Select Patient. You can use either your finger or the stylus, which can be found on the right side of the ExSpiron. At this point in the setup process, you have 2 options. You can choose to monitor a new patient, or you can find and highlight a patient who has been previously monitored on this exact ExSpiron. Perhaps they've been disconnected for a test, patient hygiene, or pad set replacement, or other treatment reasons. We will first focus on entering patient information for a new patient. To get started, touch the New Patient icon, which is located on the top right side of the screen. When entering information for a new patient, you are required to enter 3 key pieces of demographics: height, weight, and birth gender. They are marked by a small red star on the screen and are all highlighted here in red. Also, you should follow specific facility policy with regards to the use of patient name and/or medical record number. You also have the choice to select either adult or pediatric mode of monitoring. Please note that when using pediatric mode, you will also be required to enter the patient's full date of birth. Once all the patient information has been entered, touch Confirm to continue. The second option is to start monitoring a patient who has been previously monitored on that specific ExSpiron. To restart monitoring an existing patient, you simply locate the patient from the list in the box on the left side of the screen and ensure that patient is highlighted in blue. You can verify patient information has been entered correctly and touch the Confirm button in the lower right corner of this screen. The patient cable can be connected at any time during this process. If for some reason you have not yet connected the pad set tail to the white patient cable, you should do so now. Once properly connected, you should visualize a respiratory trace in the upper window of the main screen. It is simply showing you connectivity to the patient. This window is a 30-second respiratory trace window and does not require interpretation of waveform. It is simply showing that you are connected to the patient properly. These are 2 examples of what a poor trace might look like. Do not proceed with monitoring until you can visualize a good trace in this window. If you happen to see a poor trace, the first thing to do is be patient and watch the screen to see if you can visualize an error message. An error message such as check pad set or signal interference requires immediate attention. You should start by first checking the pad set has been applied properly and has good contact with the patient's skin. Ensure the pad set is connected to the white patient cable and that the white patient cable is plugged tightly into the back of the ExSpiron monitor. You might also verify that the cable is clear and free from other hospital equipment, such as getting pinched in the bed rail. If you need to reposition the pad set or think that there is any problem related to the pad set, you must use a new one. Trying to move a pad set or trying to tape it down may lead to problems in the future, and you should always just replace it. You are now ready to begin your patient monitoring. First, you must choose the appropriate monitoring mode. Our focus in this module is on volume sync mode. Volume sync can be used for any patient in any care area where you want to evaluate and monitor respiratory status after extubation, especially in patients with bilateral asymmetry. Volume sync should be started while the patient is still on the ventilator and preferably while still on full mechanical ventilation. Begin by selecting the Start with Vol Sync button from the taskbar on the right. You will want to start using New Patient Calibration. You have the option to load a previous calibration entered or perform a new calibration. For a new patient calibration, the radio button should be highlighted in the middle section as seen here. To begin, press the Start button. To perform the calibration, the system will need to collect at least 3 to 4 full breath cycles. For best results, this should be performed when the patient is under full mechanical ventilation. If the patient is breathing spontaneously, you should try to collect the breaths during a reasonably quiet period without erratic patient activity or manipulation by staff. Once you have collected the 3 to 4 breaths, touch Stop. Next, you enter the expired minute ventilation 15 on the ventilator. It is important to find and use the expired minute ventilation for this step, since sometimes the inspired minute ventilation is not fully delivered, because the ventilator may report minute ventilation breath to breath. If the patient is spontaneously breathing, you may need to look at the range of minute ventilations presented on the ventilator and come up with an average expired minute ventilation over the time you were collecting the 3 to 4 breaths. It is possible to use volume sync to synchronize with a BiPAP machine instead of a ventilator, using expired minute ventilation as described previously. In this situation, it is imperative that you assure that there is no leak from the mask during this synchronization period. Once you have entered expired minute ventilation, verify the ventilator and the ExSpiron both have approximately the same values for minute ventilation, tidal volume, and respiratory rate. Occasionally, if there was a problem with the synchronization, they may show greater than a 1 liter per milliliter variance. If so, you should consider repeating the volume sync procedure. Once you are satisfied with the synchronization values, select Apply Calibration. This default alarm screen will be displayed while the ExSpiron is calculating patient metrics in the background. Alarm settings can be customized as needed, but most likely you will accept the current alarm settings by pressing OK. If you are concerned about alarming for high minute ventilation, as for patients with viral pneumonia, COVID-19, or congestive heart failure, you may choose to set the high minute ventilation alarm at 200 or 300%, or another designated level. After confirming alarm settings, the calculating metrics screen may still be visible. In approximately 30 seconds, it will disappear and the monitor will begin displaying all of the patient's minute ventilation data. Managing patients on the ExSpiron monitor is simple. The displayed color graph makes it easy for clinicians to recognize subtle changes in a patient's real-time respiratory status and track the minute ventilation trend. As in basic monitoring mode, when in volume sync, minute ventilation is displayed in liters per minute along with a percent of predicted minute ventilation, which is calculated from the patient's body surface area. Percent predicted minute ventilation and its trend to the right are what you need to focus on for your clinical practice. Based on your clinical need, you can change the display by pressing the settings button to allow you to view the patient trend in segments ranging from 15 minutes to 12 hours. When an alarm occurs, you should assess your patient and follow your hospital's escalation protocol. You may pause alarms for 2 minutes by pressing the pause alarm button during your assessment and management. The alarm will stop when the patient resumes adequate ventilation. To pause patient monitoring for toileting, hygiene, or a variety of other treatment scenarios, or to end a patient session altogether, touch the End Monitoring icon and select Yes. You have now paused your current monitoring session. If you are completely through with monitoring this patient, you can also touch the icon that says Close Patient and simply power off the ExSpiron. Monitoring with the ExSpiron Minute Ventilation Monitoring System is really that simple. You can rest assured that while you are managing your other patients during your busy shift, the ExSpiron will be there to silently monitor your patient's respiratory status and alert you at the start of respiratory decline. This allows you to take early action and avoid the need to rescue.